How excellent is thy name in all the earth. We thank you for this opportunity to talk about maternal health, to talk about your desire for us to be healthy, to be well, and to bring life into this world because you are a God of life. We thank you for all of the vendors and the providers who have come today to give us a wealth of information, to give us life-saving and invaluable information. We pray right now asking that every person who is here will leave here with information that they did not come here with. We ask that you will be with every panelist who has so much to offer to us so that we may live better and health in our lives. Because you are a God that believes in life, that believes in vibrancy and health for all of your people. So right now we are just grateful for this moment. We're thankful for everyone who is a participant, and we ask that you will be here in our midst and your presence will be with us as we go forward with these amazing opportunities to learn, to become advocates, and to share this information in our communities and our families and with everyone we know. Thank you, God, for your blessings. Amen.
Thank you, First Lady Monica. All right, well, good afternoon, everyone. My name is Taylor Cleveland.
Marquise Alston Allison.
And we're the co-executive directors for the First Lady's Health Initiative. Our organization is a faith-based nonprofit organization, and we are focused on advancing health outcomes and advancing health equity in communities that need it most. And we do this through our partnerships with First Ladies, with churches, with the incredible providers that we have, a part of our network, as well as community leaders. And I want to just personally welcome you all to our first ever Black Maternal Health Panel and Resource Fair. So we're here today because the numbers are urgent. Nationally, Black women are 3 times more likely to die of pregnancy-related causes than any other group. Additionally, in Chicago alone, those numbers are 6 times more likely. And so this is not just about biology, this is also about systemic inequities that exist within our communities. But the good news is that this crisis is preventable. We believe that through education, advocacy, providing resources, we can indeed save lives. And that's why today we're bringing together some incredible experts on this panel, as well as providers, and bringing out families so that we can turn these statistics into solutions.
We are deeply grateful for our partners. We can't do this work without the community help and the political help that we get. And we would like to call out a couple of our partners, which is ALCI, our co-partner, Genentech, AHF Black, Pfizer, and Corey for making this possible. And also Dr. Lee and Dr. Fleming from Trinity. And now it's my pleasure to introduce our host for today's panel. Please welcome Kirsten Corley. Kirsten is the founder of Bobby, a children's lifestyle brand rooted in representation and wellness. She's also a dedicated mental health advocate who draws on her background in fashion design and psychology and motherhood to champion community, identity, and the well-being of mothers and children. Please join me again in welcoming our moderator, Kirsten.
I'm so happy to be here today. I'm so inspired by the work that First Ladies Health Initiative is doing and in partnership with the First Ladies. This is an incredible movement that they're starting, and I'm just happy to be a part of it. As she said, I'm a mom of 2 myself, and I experienced postpartum with both of my girls, so I understand the severity and just the changes that our body goes through when we're going into mothering. So I'm really happy to have this conversation with everyone here. As we've just heard, Black maternal health is in crisis right now, and we've heard the numbers, they're staggering, and it's not because of differences in education or income level, it is systemic racism and implicit bias in the healthcare system. And then there's chronic stress in navigating both of those things. And so I'm really excited to have this conversation. I'm going to introduce our panelists. So we're here today to address these issues, to unpack what is at stake, and then what we want to do is equip ourselves so we can advocate not only for ourselves, but for our family members who are going through this. So let me introduce our panelists. So first, to my left, we have Dr. Cindy Davis. She is with the melanated group Midwifery Care and Home BP monitoring. And then we have Donna Miller, who's Cook County Commissioner and maternal health advocate. And then we have Dr. Robin Jones, who's the chair of the IDPH and over the Illinois MMRC findings on preventable deaths. And then we have Michelle Alero Adeniyi, and I hope I said that right, Director of MCH Impact and March of Dimes Director as well, or that is March of Dimes, is it? March of Dimes Director and Founder. And then all the way at the end we have Reverend Dr. Stacey Edwards-Dunn, founder of Fertility for Colored Girls and executive pastor at Trinity United Church in Christ. Let's give a round of applause for her.
Hello, everyone. Welcome to the First Lady's Health Initiative's Maternal Health Fair and Panel. I'm sorry I can't be with you in person, but I hope you're enjoying all that Chicago has to offer. Please know that I am fighting the good fight in D.C. for our maternal health. When I was first elected to Congress, a constituent called me and she said, "You have to hear this story about my friend's daughter-in-law. She gave birth to a beautiful baby, but she did not survive to raise her child." Her story was heartbreaking. I did some research and held a roundtable for maternal health, and the room was packed with women impacted by this preventable issue. At the time, I did not know that Black women were 3 times more likely to die giving birth than white women. So I got to work, and I am still working to make change for women in all corners of our country. As chair of the Congressional Black Caucus Health Brain Trust, I believe Black women's health should be at the front and center of public health. We've celebrated successes to bridge the gap and achieve reproductive justice. I led the fight to make sure Medicaid covers a full year of postpartum for mothers compared to just 60 days. To anyone who's given birth, you know it takes more than 60 days to recover. Right now, though, all of our progress is under attack. Medicare is a lifeline for new mothers and babies, but Republicans cut that lifeline and gutted Medicaid by nearly $1 trillion. 2/3 of Black babies are born to mothers on Medicaid. A vast majority of Black women rely on Medicaid. We know that these cuts to Medicaid will devastate Black families. That's why discussions like this are so important. We need to arm ourselves with the resources and knowledge to fight back against attacks on our maternal and reproductive health. Thank you.
Okay, I really wanted to frame, what's at stake so that folks can understand the gravity and how we can approach it at a community level, at a policy level, and what we can do to help. So I want to start off with Dr. Jones. I want you to help people understand the implications of preventable maternal mortality. Can you talk to us about what the leading causes of maternal deaths are that you're seeing in Black mothers according to your findings?
Good afternoon, everyone, and thank you. It's an honor to be a part of this panel. And I think, if the person will allow me to, I think we need to roll this back. Is everyone familiar with the Illinois Department of Health's maternal mortality review committee?
Raise your hand if you are anybody. Okay, all right.
So let's start there. The Illinois Department of Health has a committee that rolls up into PAC, which is Perinatal Advisory Committee, okay? And the committee in which I chair is actually branch or two. There is the Maternal Mortality Review Committee that reviews pregnancy-related deaths caused by medical condition.
There's also the Maternal Mortality Review Committee B that reviews pregnancy-related deaths that are secondary to either mental health, substance use disorder, or violence. So that's the pretext. It's a group of individuals, multidisciplinary, non-clinical and clinical, urban and rural, who come together and look at the cause of the death, determine whether it's pregnancy related, determine whether it was preventable, from not preventable to some chance, good chance, and then they look at the factors and make recommendations to the state. Okay? So that's the framework in which we're working. We put out, and I use the word we intentionally. This is not a Dr. Jones, or this is not the governors, or this is not the IDPH directors. This is a team effort that's represented, hopefully, but good in its entirety. As such, we put out 3 reports. Our last report was released in October of 2023, and we have a report that will be released before the end of this year. The findings on our most recent report from October of 2023 revealed that substance use disorder accounted for 32% of the pregnancy-related deaths. As quickly as I say that, I want to pause because there were other things that were close behind that, such as cardiac or coronary conditions, pre-existing chronic medical conditions that would include things like hypertension, diabetes, sepsis, which is an infection throughout your body, mental health disorders, and embolism. Embolism can be a blood clot to your lungs. Embolism can be what we call a fluid embolism that can go into your system. But those were the leading causes of maternal deaths. I also want to add, when you're reading about causes, make sure you understand this might be a leading cause for all women in the state, but I will say that for African American women, medical causes is still one of the leading causes in addition to substance use disorder.
Okay, I just want to make sure I'm hearing what you're saying correctly, and you painted the picture of 30% of these are the causes. Are these labeled preventable then? Those the causes that you just mentioned?
When we look at preventability, once again, we're looking at no chance, some chance, and good chance. We're looking at not pointing the finger at a particular provider, but we look at systems, we look at providers, hospital, community. So that's what we're looking at when we're trying to uncover whether this was preventable. Unfortunately, in our most recent report, we found that 90% of the maternal mortality, pregnancy related, was preventable. Wow. Okay, 90% in some way, shape, or form.
How do systemic inequities in healthcare contribute to these outcomes?
Let me start by saying this. If we were to focus only on individual risk factors, such as economic, education, transportation, if we only focus on that alone, we would be amiss. We need to unpack the underlying context to why, for example, Black women are more likely to die during pregnancy. We need to unpack the underlying context of why 90% are preventable. So let's talk about the barriers, and that's going to help us unpack this, okay? We'll start with poverty and lack of insurance. Two huge ones. If healthcare is not affordable, or if you do not have health care, you have limited access, which therefore means that necessary medical care is not available to you. That's a huge one. If we look at geography, where you're located, whether it's a rural area or whether you're in an unresourced or underserved area, your access to quality healthcare, all healthcare is the same, quality healthcare is limited. When we look at language barriers, and I would encourage us, we're sisters and brothers. What affects me is going to affect you. You might not realize it, but it does. So if we talk about language barriers, there can be miscommunication, misunderstanding that can lead to ineffective medical care. When you look at things like for care coordination between the different providers and the agencies, there gaps in care. I can look at my friend Donna over here and say, okay, Donna, you need old power, you need food, and you need transportation by your 15 minutes run. Warm handoffs, making sure Donna has the information connected to the right people. All of those things come into care coordination. When you look at the systemic barriers that exist, when you and I are not deemed worthy or important, and please understand your system will start, we have centuries of Black women being told and treated like they're not worthy and they're not important. When a society has that type of mindset, what happens is we end up with mistrust, there's misunderstanding, there's providers not listening, there's lack of access to certain treatments that others might avail. All of these things come into play when we're talking about maternal health and pregnancy-related deaths.
Thank you so much for that, for expounding too. I really, I want to go over to Ms. Adeniyi, because your organization is working directly to address these systemic inequities in healthcare for Black families. Thank you for the work that you're doing. Can you talk about, well, she's told us a lot about the key gaps in maternal care services. Can you talk directly to what your org is working to address in those gaps?
Sure, thank you so much. And I'm so happy that you mentioned the underserved communities and just not having the access. So I don't know if a lot of people realize, but even though we're in the Chicagoland area, we're still experiencing a maternity care desert in an urban setting. We have had a number of maternity units, labor and delivery units, clinics, anything with obstetric care closing, literally. From the south suburbs, the west suburbs, the west side, south side, it's happening. And so unfortunately, that causes people to have lack of access to care. And then they unfortunately will present to an emergency room in an emergency instead of having, timely prenatal and postpartum care. So what we do at the March of Dimes is we connect and convene cross-sector organizations in the city and in Illinois working on maternal health initiatives, and we create different solutions of how we can help close these care gaps. Some examples of the work that we're doing currently, we have a doula hospital integration project in partnership with Advocate Trinity Hospital, and our doctors are amazing. Dr. Lewis, she's actually here at the Adeniyi Village Clinic. She is one of our champions. She provides us with referrals to her patients that could really benefit from the doula support. We provide that doula support to them free of charge. The doulas are paid. The doulas are also trained to provide clinical collaborative care in a clinical setting. So doulas are, let me just stop. Let me rewind. Doulas are non-medical support professionals that can navigate and help pregnant people and families through prenatal care, birth, and postpartum. So I want to start there. And so why that is so important is just based off of what doctor said. Most prenatal visits or doctor's visits are about 15 minutes long, right? So that language barriers, we can speak the same English, but if you don't understand the medical terminology that a provider is saying, you're gonna leave not really understanding what's your next step. What am I gonna do? Or they may have made a recommendation, but you don't feel comfortable because you don't understand, but you didn't have time. That's where a doula can come in and help fill that gap by helping you walk through your options. They don't make the decision for you. They present you with all the information that you need. They support you in making an informed decision about your health and your next steps. So that's just an example of some of the work that we're doing with that doula hospital project. We're on year 2 of that right now. We've had 21 families paired with 7 doulas each year, providing them cost-free care, and we have got some amazing outcomes and feedback from that. So we're really excited to continue that momentum into 2026. Thank you.
I feel like that deserves.
Oh, that's incredible. But we're still listening. I appreciate it. So one of the other initiatives that we're working on is our Healthy Pregnancy and Community Wellness event. Our last event actually took place right here in Imani Village in August. And so we have these events in the community on the south side at different locations. Our next one is coming up in November in Chapman, right down the street at the Shine Bright Center on 87th Cottage. And so at those events, we provide resources, wraparound services, food, groceries to pregnant and postpartum families and just the community at large, so that we're bringing the clinic to the community. We're bringing the resources to the community. And we have over 30 of our partners, I'm talking about from insurance to education to healthcare. They all bring all their resources together, and we really fill that room with love and resources and connection, so that people can understand these are the options that I have, whether I'm pregnant, seeking to become pregnant, or I've already started a family. And we're really excited. We've had 3 of these this year. We're building on that momentum. And our next horizon is creating a mom and baby mobile health center. So it will be a 40-foot unit with 2 examination rooms, 5 days a week, rolling through the city of Chicago and Cook County, providing prenatal care, woman well visits, pediatric care, and mental health services. Because the maternity care desert is real in the area, and these are some of the solutions we're creating to kind of, work in collaboration with our partner. So there'll be a clinical partner, there'll be a funder, and so we've been working collaboratively with all these different organizations. Meridian is here, and they have been an amazing partner with our community wellness events that we've been having. So those are just a little bit of what we're doing in Chicagoland, but we continuously do a lot of advocacy, and we also do a lot of education to kind of, help close those gaps in the professional world. Healthcare professionals need continuing education, and then also, consumer, everyday people like you and I.
Yeah, I think when you were talking about it, I was thinking in my head, how are you guys funding all of these? I heard you have a lot of partners, but is there a way that we can support you, or how?
Yes, always. So, for example, the 3 events that we had this year in person, we have 2 virtually too. But the 3 events that we've had in person, the generosity and funding of Meridian Health Plan has been, helped that happen. And some of the ways that people can contribute in general, you can always donate to the March of Dimes. you can volunteer and help us create opportunities for our moms. We've had some employee organizations, PRGs and community volunteer groups create postpartum baskets for our moms in the Doula Project. We've had people donate diapers and wipes, groceries. We're trying to do a coats and winter essential giveaway during our November event. So hats, gloves, scarves. If anybody wants to have like a donation drive at their church or organization, we can collaborate. So those are some of the ways that we work together in order to bring the things to the community. But yes, our funder for the Doula Project is Plus Diagnostics, actually. They have a health equity arm for their foundation, and then Meridian Health Plan is funding the other large mission.
Wow, that is really, truly incredible. Thank you for the work that you're doing, and we're going to continue to support you. So at the end, make sure we know how to get in contact. Dr. Stacey Edwards, I read your story online before as I was preparing for this, and I think my jaw was on the floor, just all the different twists and turns. Can you please share your personal story and how it inspired your work in maternal advocacy?
Absolutely. Well, thank you again for allowing me to be on this esteemed panel. My story starts in 2007. Soon after my husband and I got married, we struggled to get pregnant, and so we went to the doctor, and we would receive a diagnosis that we were unexpected. We did not expect it at all. The doctor diagnosed us both with infertility. My husband had already had children, so he was diagnosed at that time with secondary male factor infertility, and I was diagnosed with unexplained infertility. The infertility that we didn't even know existed within the Black community, because no one ever told me that Black people could struggle with infertility. We just thought that Black people were hyper-fertile, and that if we looked at each other, we could get pregnant. But we would find out very different, that Black people were struggling with infertility. And so when we were diagnosed, I would be going into clinics, and there would be very few Black people there. There was not any pictures of Black babies on the wall. And I really didn't share my story because I lived with a lot of shame. And so one of the things that would happen is that at the church where one of the pastors, people were coming to me for infertility pastoral care who had no idea that I was struggling. And so as a result of my experiences, and at that time, I was about 5 years into my own journey, I ended up starting an organization that is called Fertility for Colored Girls. My journey was filled with twists and turns, as you stated. It wasn't until my 5th year into my infertility journey that my my doctor said, something has to be going on that people have not been telling you. I'm gonna put you to sleep. And I'm gonna give you some anesthesia and put you down. We're gonna go in. And when I came up, she said to me, this is my 5th year. I'm $100,000 in. She says to me, has anyone ever told you that you had one fallopian tube? And has anyone ever told you that you have a unicorn uterus? This was in 2012. In 2007, I was told I had 2 fallopian tubes, and my uterus was perfect. Now, surely my uterus did not change over 5 years, and nor did I lose a fallopian tube. But someone in 2007, the technicians were not honest and transparent with me. And so that impacted my journey, but it was a game changer. And so in 2007, quickly to fast forward, I would give birth to my daughter after 7 in vitro cycles, who is now 11. At 50, 7 years later, I would give birth to a set of twins, identical girls, after a transfer of 1 year. So I started my organization, Fertility for Colored Girls, and now it's called Fertility for Colored Girls and the Guys, because there was no place for people of African descent to be able to share their journeys and receive support in a space where people really understood. We started in 2013. My thought was that we were going to be in Chicago, providing education, awareness, support, and encouragement. And now we are currently in 17 locations across the country, providing support groups, about to open our 18th by the end of the year in Raleigh, North Carolina. We spend all year around raising money to give money away to women and couples who cannot afford treatment. Infertility is a critical issue in our community as well, because just as Black women are dying at 3 times and 4 times the rate unnecessarily in childbirth, Black women are experiencing infertility at 2 times the rate as our Caucasian counterparts and are less likely to access treatment. And research shows that women who do end up accessing treatment and becoming pregnant, they are most likely to experience complications in pregnancy. And so infertility, as well as maternal health, are deeply connected. The truth is, infertility and maternal health, they are reproductive health issues, right? And they should be framed as such because they are deeply interconnected. We have women in our community and men who are struggling to conceive. And when they conceive, on the other side of that, there are still challenges as well. One of the things that we know from a historical standpoint, I'm going to say this is why we founded Fertility for the Colored Girls. Again, we provide support groups, we raise money year round, we vet organizations, we vet doctors to ensure that those doctors are going to care for women and couples that we send their way, because we understand within the medical system, Black people in particular have a lot of medical mistrust. Medical mistrust, as was stated, that goes back for centuries, because there was a doctor, who I hate to say was a doctor, who ended up experimenting on 3 teenage slave girls without anesthesia to actually create what is known the speculum that we use, right? And so this particular doctor and the work and the experimentation that he did on slave women has shaped the education of doctors and still exists today. A study was just done about 2 years ago that showed that doctors still believe, and medical students still believe, that Black women can endure pain more than white women in any other ethnicity. That is just 2 years ago. And so that, the work of Marion Sims, although he is dead, it still exists in our medical system today and shapes the perspective of doctors and how many doctors and how they care for people of African descent. Finally, some of the work that we have done is we hold programs, again, across the city and across the United States around infertility and reproductive care, not just for women, but also men, because men too. Usually when couples are trying to get pregnant, a lot of times they think that women are the main issue, when the reality is that men are 50% of the reason why people experience infertility. So we have done everything from Black Fertility Matters 2 tours. We partner with doctors across the country to ensure that they are, to help them to be more culturally sensitive when patients are coming their way. We're also working with residents and medical students as well to educate them, to help them to understand the importance of reproductive justice and reproductive health as well in the Black community and caring for African American patients. One of the things that we are working right now is that we just received a grant from the American Society for Reproductive Medicine to do a documentary. The documentary is called Hold On to Hope, Infertility and Reproductive Health in the Black Community. It will be coming out this fall. Commissioner is in the film as well. And so we want you to keep your eyes open. We believe it is a groundbreaking film, as it will have 3 curriculums that will accompany that film for the community, for churches, as well as for doctors and medical providers as well.
Your story is such a power of relentless advocacy. That was something that I saw as a theme when I was reading, and standing in your power. And we're trying to equip everyone here to be able to do the same. I think you addressed this a little bit, but talk to me about the stigma around fertility. You guys are addressing that at a level of talking to health professionals and trying to get them to be more willing to treat Black people, but how do you address the stigma that's in the community around fertility and infertility, I guess is the
Yes,
question.
yes, certainly there is a lot of stigma and shame around infertility in our community because it starts from the center that people believe Black people are supposed to be hyperfertile, right? And we have believed that hype as well, that we are hyperfertile, and so that if something happens, if we end up struggling with infertility, there's a lot of shame. I do think too that it goes back again for centuries, particularly to forced reproduction and slavery, right? I think that shapes our understanding of our bodies because particularly during slavery, we were forced to reproduce, right? And if we could not reproduce, then because we were in this country, both here in North America as well as in England and all over the Caribbean, we were brought here to reproduce in order for to ensure from an economic standpoint that that's right. So the more people we're able to give birth to, the greater, from an economic standpoint, this country could be. Right. And so what would happen during slavery, for those of you who might not know, if you were not, even when you would go, when they would choose slaves, if you remember, they would hit them on their butts, they would hit them here and there, and they would say, oh, this one will be good, we'll be able to give birth. If you were not able to give birth, you were treated harshly. You were beaten. You might be sold off from family. And so there was a lot of shame. No one wanted anybody to ever think that you could not give birth. And so I believe that trauma has been transferred from generation, it is cellular, and it still exists amongst us. And so even today, for those of us, we believe, one, is that we're, we live in a community where we're hyperfertile, that we can give birth. And if we cannot, we live in it with a spirit of shame, right? And then we allow infertility to define us. Well, we cannot allow infertility to define us because infertility is a diagnosis. It is not who we are. So when we understand that infertility is not who we are, right? Then we can begin and understand that it's a diagnosis and that we can access care for treatment to build our families. Then we can begin to move away from the shame. When we share our stories, it also helps us to understand that there's other people who are experiencing what we experience. I'm gonna say this, I'm passing mine on. How many people in the room know somebody who has experienced infertility? How many people know someone who has experienced a miscarriage? How many people know someone who has struggled when they were in the hospital, maybe even dealt with maternal death or dealt with challenges in the hospital and was dismissed by doctors? Right? But we don't hear the stories often. But when we raise our voices and we share our stories, we then can begin to, shame will begin to be removed.
Thank you. Thank you so much for that. Dr. Stacey Davis, you're a midwife, and I know you believe in culturally rooted midwifery care is the best option for Black mothers. Can you talk to us briefly about why that's your belief? And then I want to ask about the importance of blood pressure monitoring to prevent preeclampsia.
Thank you. And for clarification, I work in a midwifery group practice. And I feel like the women on this side of the room have just made my job a lot easier to answer your question because we heard about procreation for slavery reasons. And guess who was delivering those babies? Midwives. The medical model had not been introduced. midwifery care goes back beyond the 1600s. And as a first, I'm going to break it down. First, I want to say I've been a social worker for the last 27 years, but the last 6 years I've been in public health. So I'm saying that to say a lot of times when I was talking to one of our other esteemed panelists about, we look a lot at numbers, just numbers. What is happening with numbers? But lately, I've been more interested in what is the story behind those numbers? Why are women seeking care with a midwife? And if you really look at it, I think that one of the main drivers for women seeking care with a midwife is they're looking for somebody who's culturally competent. They're looking for somebody who's culturally congruent with what they're looking for. They're looking for somebody to say, I see you, I hear you, I understand what you're experiencing and what you're going through. And then I heard another panelist say, you go to your prenatal visit, it's approximately 15 minutes long. I heard another panelist say, you have needs in transportation, you need food, you need housing, your appointment is still 15 minutes. I heard another panelist say how important care coordination is. I'm going to bring all of that together. When you look at the practice of midwifery care, there's a lot more freedom. But we don't want to just talk about what I think I see. We want to look at the 30% drop in cesareans. We want to look at the increase in healthy birth outcomes. We want to look at the propensity to have less premature births when you have a midwife as a care provider. And in our practice, our prenatal sessions are actually 2 hours long. And 2 hours gives us an immense amount of time to cover so many subjects. So if we have social determinants of health that are impacting your pregnancy, when someone is pregnant for the first time, I don't think there's anybody in this room who is pregnant for the first time and didn't have a little bit of nervousness, didn't have a little bit of things that they were concerned about, thoughts, feelings, emotions, etc., that can barely be covered in a good 15 minutes. So this 2 hour window allows us the opportunity to talk about those things, to talk about what they're thinking, what they're feeling, the emotional roller coaster, how the family and how the community can help. All of these things are important in a midwifery practice, and arming them with education, because education is power. Yeah. And you asked a little bit about blood pressure monitoring.
Yeah, just some tangible things that we can talk about that people need to be looking out for.
Oh, I think that education is key. And when I say education, education is key. You can look at home blood pressure monitoring. Education is key, but compliance with that education is vital, because we know that in the Black community, preeclampsia is prevalent. And when I say preeclampsia, eclampsia is the seizures that can result from elevated blood pressure and other factors that lead to that condition. Headaches that won't go away with medication, visual changes, right upper belly quadrant pain, increased swelling over a fast amount of time. All of these are symptoms of preeclampsia. But if you're monitoring your blood pressure at home, your midwife has already armed you with what the parameters should be for what's a dangerous blood pressure. What is an elevated blood pressure? So when you're monitoring and you're reporting that to your midwife, she's able to better get that care coordination team together. We need to make sure we're taking a look at that. But then we have some, if we really look at it, we might wonder now, why wouldn't somebody monitor their blood pressure at home? Why wouldn't they report that? And although we might know that it is something good, among the Black population, sometimes too much knowledge is power. If I know my blood pressure is elevated, I'm scared. I'm afraid. I'm fearful. The doctor might tell me to go to the hospital. I don't want to leave my family. I'm not having any symptoms. You know, all of these things, stress, all of these things may preclude them from even monitoring their blood pressure. So,
raise your blood pressure.
Yes. So we know that fear within itself is a paralytic. So if we can work past that fear while we're talking to them during that 2 hour period, and it's not just us there, it's a group session, it's group care. So their peers are probably more impactful than we are, because at the same time, they're all experiencing the same thing at the same time in different ways in a different body. And they're able to share that with one another and thereby be helped and see the significance of taking care of themselves, but that person who is listening to them and making them feel important, making them feel like their care and their concern is validated, is one of the drivers that I heard from our women of why they sought care with the men.
Yeah. And the practical tools that you're equipping, not just mothers with, that is a part of this movement as we're wanting to equip families and communities because those are the people around you who are going to be your support system and they need to be able to advocate for you as well, especially in your most vulnerable moments.
Absolutely. And we invite them to come to group as well because the more they know, the more they're able to.
Right. Donna Miller, Cook County Commissioner, I want to ask you about how Cook County is addressing health disparities at a policy level. Can you speak to that and basically the role that data and research plays in developing maternal health strategies?
Yes, great to be here. And before I answer that question, I have to say, rooms like this don't always happen. They were ordained to happen. So I think I'm just so honored to be on this panel. First Lady Moss, thank you for this. We've been together on related things related to cardiovascular disease. Taylor was my babysitter way back when my kids were little. And Reverend Stacey, we're doing the infertility that got those babies here. March of Dimes has been very influential in Cook County. So I just say this is a full circle moment that it's really great that all of you are here listening and getting the information that's so important to take back to our communities. Each one of us has done something related to maternal health, but it all comes together when we look at how we're going to influence and communicate the information out to our community. So I just want to also challenge all of you who are here today to take what you learned here today and tell somebody. Because we are not able to make the information go viral by ourselves, but these kind of communications, these happen because people talk about it. I have two boys that are 20 and 21, and anytime I post something about maternal health on social media, I'm like, whatever I post it, y'all better share that with your friends, because I'm not talking to my friends, I'm talking to your friends. And I'm talking to your generation. If you guys are not aware of this type of information, and that goes into how policy does shape these conversations. So for anyone who thinks, oh yeah, I'm not involved in politics, or I don't care about government, you do. Whether you know about it, or be about it, or do anything about it, it affects you whether you're engaged or not. So I've had 3 maternal health hearings over the last 3 years that brought experts together from IDPH, Illinois Department of Public Health, from Cook County Department of Public Health, from Chicago Department of Public Health, to say, what are we going to do from a policy level? How can we take some of our money, because that's what we have in government, even though they say there's no money, there's money, there's a budget, and the budget has money in it. We just have to decide how that money is going to be spent. And rooms like this can influence how that money is spent. If we don't hear from you and you think everything's great, then they just say, oh, well, this budget looks great. And if there's nothing in there about the issues you care about, that's what they're going to go with. But if they hear people say, what about maternal health from a public health standpoint? That's why I created the hearing, so that people could come testify and talk about what they care about related to maternal health. And I partnered with Congresswoman Robin Kelly on her panel for women's health. On the federal level, what's happened over many years, when she started championing this, we all know we're in a volatile situation in our federal government, but those kind of conversations are shut down. Right now, at the national level, they've taken women's health research completely out of the budget. I wish everyone in here would write a letter to somebody and say, something just as basic as, we don't think that's a good idea. When they don't hear us saying the opposite of what they've done, they think, well, we'll just do it and no one's going to complain and everything's fine. Please don't let everything be fine. If you don't know Robin Kelly, who's your congresswoman, whoever your congressperson is, you can send them a letter and say, what is happening for women's health research related to infertility, related to uterine fibroids, related to reproductive health, related to maternal health. All of those are being wiped out of the budget on the national level. So we can do things on other levels. We have advocates on the state level, the county level. That's where I felt like I could do something for the budget that we have. So everybody knows you're in Cook County, right? You know that. Cook County is the second largest county in the whole country. Did you know that? Cook County is about to pass a $10.2 billion budget. Of that budget, about $5 billion of it is healthcare. So within that healthcare budget, over the last few years, I was able to find what do we need to do to increase the maternal morbidity rates. So one of the things was to have a doula program. That was mentioned here for the families that are part of the March of Dimes. But on a bigger scale, we want to look at how we can do it from a system standpoint at Cook County Hospital. So I was able to get $1 million in our budget for the next 3 years. That means $3 million for doula care for any woman who's part of Cook County Health and Hospital System at any point in the pregnancy and postpartum. So we've heard from the data standpoint that these deaths are 90% preventable. So if all we need is to have another system in place, whether we have midwives that people can go to outside, I'm just talking about the healthcare system that I have influence over. So why not have doulas be part of it? So they were like, oh, well, nobody even thought about that before. Okay, well, we're thinking about it now, and now we got money for it, so let's implement it. So our doula started in March of this year. I'll be very anxious to see what those outcomes look like. But aside from that, we're raising an education level and informing our community, whether they come to Cook County Hospital or not, that doulas do help make an impact on maternal morbidity outcomes. And we want young people to know that something that's 90% preventable means we need to prevent it, period. There's no ifs, ands, or buts. If you took a test and you got a 90, you got an A in most cases, right? So you're not getting an F. So we don't have an F rating for what we can prevent, but we do have an F rating for the deaths that are occurring. And we can use government on every level of government to influence that. So that's one of the things that I've done on the national level is to create other counties to have doula programs in their counties. Whether it's a big county or not, like I said, Cook County is the second largest county. That means every other county in the whole country is after Cook County. So they can do exactly what we've done here in their counties. If they can find money, it might be a little money. I'll give you an example. One of the commissioners who's in Iowa, she found $150,000 for a doula program in Iowa. So this is how we get the information to go all the way across the entire country so that when we're looking and having conversations about what maternal morbidity looks like, no matter where you are, we have a plan. And the plan just has to be implemented so 90% preventable happens. And it happens in small communities, big communities, and it happens across the board because now we're also being more well-versed in what that looks like from every level. You don't have to be a healthcare provider. You don't have to be in government. You can be a person in the community. And now I hope that everyone will say to someone that they know is pregnant, hey, do you have a doula? Have you thought about that? And the other thing that I want to empower the community, you are the community to do is don't let someone go to the doctor alone. If you know someone who's pregnant, grab their hand, take them, and you go with them so that you can be some eyes and ears that they can't see. Because I know when I was pregnant, I'm like, I don't know what you're talking about. I mean, your mind is crazy. And then after that, you're crazy. In a good way. I don't mean crazy that. But you're filled with all kind of other things that are taking up your energy, like the baby that you just had. And so if you grab onto someone and you go with them, no offense to the physicians that are here are not the ones we're talking about, who don't listen, who don't care, who don't have the empathy and don't have the compassion to have the conversations that last longer than 15 minutes if necessary. We're talking about other physicians where they just might not step back and say, wait a second, I am talking to someone who is fearful or someone who just needs extra information. But if you have somebody there with you and they're like taking notes and they're saying, what did you say again? The what? Because all of us don't have healthcare literacy as our normal language. And so if you have someone,
Overwhelming experience.
it's an overwhelming experience anyway.
Yeah.
So I'll just say that's what my kind of ask every time I talk to a group is, if you know someone pregnant, tell them you're going with them, and you're going to send your mother, you're going to send your cousin, if their husband. And I also just want to say that now there's a dad doula group that has been formed.
That.
Yeah.
You've given us, we have homework now. We have to write to our congresswoman, man, whoever it is, and we need to talk and speak up about maternal health care and what they're doing with the funding. But I'm also so encouraged to have people like you in power who are getting the dollars that we need to have the proper access to resources. So let's give a round of applause for Cook County Commissioner. Thank you. I want to open up the floor for questions. If anybody in the audience has a question that they would like to ask, yes. Marquise running down with the mic.
Thank you. You guys are all very lovely. I am very much enjoy being here. I'm Irvin Palm. I'm a third-year medical student. I'm planning to go into OB and fertility. I guess my question is very general. I guess, how can I be an advocate for my future patients, especially in the face of like a preceptor who may not fully understand the implicit biases that they may have?
Go ahead. What's up? One person answer just so we can get.
Well, I'm not a doctor, so I will just answer as a non-doctor. I do think a doctor should answer. But I just think that when you're in the room and you know something is being said that could be an implicit bias, you have to call it out in front of everyone. And that might risk your grade or what have you, your relationship, but you have to say, actually, that's not exactly true. And you have to let them know that you know that and that you're willing to stand up for that. And I think that, I always say healthcare literacy is such an important part of that. You're going to be the expert as well as far as how that conversation goes, but the patient is looking to you to advocate for them.
Congratulations. Look forward to handing the baton off. You have a lot of power, and let me tell you where your power lies. First of all, you can be the advocate and voice for that patient. And if you don't feel comfortable in that moment, everybody reports to someone, okay? So if in that moment you decide you need to speak up, speak up. There may be risk, but life is one big risk, right? If in that moment you feel it would behoove you to go to the director, the chairperson, the chief medical officer, the CEO, you see where I'm going with this? IDPH, you can do that, but your voice is important. If in that moment you feel you need to go back into the patient's room and say, actually what you heard was misguided, you have the opportunity to say, we have patient experience measures, which is a survey that will allow you to have an open voice patient. Your voice matters, but you have to exercise it. All right? So making sure that they're completing the survey, but your voice is important. If you see that your colleagues are acting out, because it starts somewhere. We didn't just put on a white coat one day and decide we're not going to respect people and we're not going to listen to people. It started a long time ago. Call them out. And like I said, look at the chain of command and go up the chain of command and let them know what I heard was inappropriate.
There you go. Got your words. Maybe one more question or maybe two more questions. Okay. Does anybody else have a question that they want to ask? Okay. She's coming to you with the mic.
Good afternoon, everyone, and thank you for all the resources and wisdom you've shared. As a mom and mentor to many, I would like to hear from you all what you think we should be telling our young women, or how we can empower young women to go into these different spaces with a different approach and or perspective as they are learning their bodies and advocating for themselves and hopefully not repeating some of the things that maybe we didn't do so well.
That's a great question. Who wants to take that one?
I think particularly in our community, it's very important that we teach our young girls and young boys how to prepare their bodies. For so long, we have been told, telling our children, we have come from a generation that have been told, don't do it. We have not been told what to do to prepare your body so that when time comes and you're ready to move forward, what to do. And so I think that it is imperative that we educate our young people. For years, we've had sex education, again, told them not to do it and not to do it and not to do it. But again, what happens when we are communicating to our young people about their bodies, how to prepare their bodies, what to eat, what not to put into their bodies, thinking about even the wigs, the weaves, and all of that that has lead and all types of toxins in it in the foods that we're eating, thinking about those things. What if we begin to talk to our young people about the questions that they should ask when they go into the doctors, right? What happens when we talk to our young people openly and being transparent about starting menstrual cycles? And if they complain about painful periods, we don't say that's what we just have to deal with, take an aspirin, but we take them to the doctor to walk with them, go with them to the doctor to have conversation about that. And so those things for me become very important. And then we approach even pregnancy as a village and a community. My mother talked to me some, but what happens when we as women, we have full conversation, healthy conversation with our young people, whether it's, from teenage years throughout, about reproductive health. And so for me, I think that that's very, very important. If they are thinking about becoming parents, we talk to them even about egg freezing. We talk to them about what exams they need to be having beyond pap smears, right? Knowing your own fertility status, knowing about how many, ovarian reserve. For me, I think that it's very important that you have holistic conversation with the children from beginning and throughout. Age appropriate, of course, but I think that it's important that they prepare themselves so that when time comes, they will know what questions to ask. They will have been doing things all along for that particular moment. And someone just said to use your voice, right? If you're not comfortable, ask the question, right? Advocate, teaching them to advocate for themselves. If they're not comfortable with what a doctor is saying to them, it's okay for you to go seek out another doctor. And so really giving them the tools for their toolbox so that they can advocate for themselves and navigate their own reproductive health journey and their health journey as well.
Yeah, and that, I love everything she said. A lot of the things that I was thinking, she said, so that's great. To add on to that, in addition to advocating for yourself and speaking up when something doesn't feel right, or if you have painful menstrual cycles, diving deeper into why that is, having those conversations with your family members and understanding what age did you have? Oh, you had a hysterectomy? When did that happen? And then why did you have to have it? Oh, you had preeclampsia when you gave birth to me? Like, I found that out, honestly, y'all. I found out I was born premature due to preeclampsia. I didn't find that out until I became pregnant. I just knew all my life that I was born prematurely. I never understood why. And that's what I'm saying. In our community, a lot of things at a high level, surface level, but we don't dig deeper and have these conversations with our family members to understand why. Another big one,
we have a lot, like she said, there's a lot of chronic conditions and comorbidities that lead to a lot of the issues that people experience during pregnancy and after pregnancy. Some of them are hypertension, high blood pressure, diabetes, whether it's gestational diabetes, which develops while you're pregnant, or diabetes that you already had coming into the pregnancy. So preparing your body, working out, eating healthier, managing what you eat and your intake, and understanding that we have this myth in our community that, oh, that just runs in my family. No, 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 no. You may be predisposed to the higher likelihood of that happening, but no, this is lifestyle related. So for me, high blood pressure and diabetes runs in my family, which means a lot of people in my family have it. But I made sure, as I was preparing to get pregnant, I was already dealing with PCOS, which is something I had to find out through advocacy, advocating for myself, finding out why am I having such a painful time when I'm having these cycles? Why am I experiencing pain in my lower abdomen? I got that diagnosis. Then from there, I was able to dig deeper and find out, oh, if I start working out and losing a little bit more weight, there'll be a higher likelihood of me becoming pregnant. Okay. Then I started managing the way I was eating, working out in the way that worked for me, which was a lot of walking, riding bicycles and stuff like that. That really helped me, and it helped me avoid the high blood pressure, the preeclampsia, the stroke, all the things that were already in my family, including diabetes as well. So I'm just using myself as an example, but I really want to encourage everyone in the audience to have these conversations with your family members, whether it's your niece, your cousin, your daughter. Talk to them about what they're experiencing before even if they're not pregnant yet, before they get to that point about their reproductive health and their health in general. And then being able to share more about some lessons learned from other people in the family that may have experienced those things as well.
Yeah. Keeping the lines of communication open with our kids coming in and with our family can save lives. Is there any other, okay, one more question. She's gonna come to you with the mic.
Thank you so much. And my question is, with all that's going on around policy and Planned Parenthood policies and changes, can someone speak to what we as a community should know or what we should be expecting around ladies and guys going to agencies that are funded or connected to Planned Parenthood? What kind of things are going on currently?
So, yeah, I'm the former board chair of Planned Parenthood of Illinois. But at that time, when I was on the board, everything was good from a funding standpoint. Again, this goes back to funding. So what we have to do is, and I keep saying, blow the whistle, get on the bus, whatever you need to do, but we have to be vocal advocates. They just are closing 4 Planned Parenthoods in Chicagoland area. One of them's in Inglewood. We can't say that's okay. We have to be vocal advocates, but then Planned Parenthood is getting funding from the federal government or lack thereof or wherever. So we also have to be the supporters. So Planned Parenthood is an agency that gets donations. So we have to be able to also build up from the community level to be supporters of something like Planned Parenthood. Many of us are not, but they're in the communities that we want to be represented in. And then we don't see them when they close and it just goes away. That's again where I feel like advocacy also helps on the governmental level. We tried to create a plan from the county level to say when the Planned Parenthood closed in Inglewood that the county could absorb some of those patients to come into the Inglewood Cook County Clinic. We need people to say that might be a good idea. Or we need people to say, when we're in this funding where we're in right now, every level of government, every meeting is open to the public. And I say the public is not necessarily there. If the public is there saying, why'd you do this and why'd you do that, it makes people stand up and have to answer questions that are not necessarily public-facing questions.
That was great.
And I also add, for some, when they hear family planning, they immediately go to abortion. Don't be fooled or miseducated. Contraception, treatment and discovery of screening for sexually transmitted infections, well, women examination, be well informed, all right? So that you understand what these different organizations are doing. If you were to ask what right now is the most important thing you can do besides all the things you mentioned, and this is my opinion, the most important tool you have is your right to vote. But listen to me carefully. Your right to vote does the things, funds the things that the commissioner is stating. That's what your right to vote does. So when we sit here and we talk about disparities, we talk about potentially preventable, we need funding. You need to vote for us to have funding. It's as simple as that. It's not simple, but your power is in your vote. And spreading that word to your loved ones, your friends, your not so liked friends. You need to get the word out there. It's not going to fall from the sky, but use your power.
Thank you. And I think in closing, I wanted to ask everybody on the panel, and you just told us our one thing that we can do to protect maternal health is to vote. So can everyone just give one sentence on if you could share one thing with a mother on how they could protect her health, what would it be?
The one thing I would say is never function in a silo. None of us do anything with greatness alone. We all need somebody to lean on. And the old African proverb says, if you want to go fast, go alone. But if you want to go far, go together. Love that.
And I'll say from a policy and legislative standpoint, know who you're voting for. Everybody's not on the same page. They might say, oh, I do this, I do that. Do your research, and when it comes time to vote, vote for the people who match your values and what you want for your community.
Yeah. Whoa. One thing, right?
One sentence, if you go long sentence, okay.
Okay. So my one thing that I want everyone to know is you should educate yourself as much as you possibly can. And I know TikTok and YouTube and all of that is great, but make sure you have like research, evidence-based information to equip yourself to make the decisions about your life. You don't have to just take what anyone tells you is going to happen to you at any stage of your health journey. You have the power through educating yourself, and also, if you don't have a village, you can build a village.
Mine is educate yourself, know you're not alone. And I will close with, make sure you go to Fertility for Color Girls website, sign our petition to ensure that there is a National Black Infertility and Reproductive Health Week that covers all of this, that Commissioner Donna Miller ensured that we had one in June for Cook County. She created a resolution here in Chicago for one this year. But I need you to go to your websites right now, and I need you to sign our petition. And that's my short sentence.
Let's give a round of applause for our panelists. I hope everybody learned something today. I know I did. I know I did. Raise your hand if you learned something new today that you didn't know, because I learned so much and I feel better prepared to just mother my children into their future, but just my future. I don't know, maybe. We'll see. Yeah, so I'm going to encourage everybody to stay and utilize the resources. Marcus, did you want to come up and say something?
Yes. Give a round of applause.